Here in Perth and Kinross, we want to support people to lead healthy and independent lives. One of the main aims of the Perth and Kinross Strategic Commission Plan 2020 to 2025 is to support people to lead as independent, healthy and active lives as possible in their homes. People who experience ill health or have a range of support and care needs due to mental health, homelessness, learning disability, age or substance misuse issues often need suitable accommodation and support to live independently. Housing plays a vital role in driving down health inequalities. A good house to live in is one of the foundations of a healthy life. High quality housing also enables people to be empowered to live independent lives at home or in a homely setting, avoiding the need for more costly health and social care. We already have a good range of adapted accommodation and support options for people when they need help. Our second housing contribution statement supports the development of future supported accommodation for people who need it in Perth and Kinross. The housing contribution statement has been developed in partnership with housing and health and social care practitioners. It sets out how the local housing strategy can support the delivery of the health and social care partnership aims, ensuring people have access to suitable housing and support to enable them to live as independently as possible. It also meets the aim of the Perth and Kinross offer, providing partners with a meaningful platform for people and communities to work together to take the decisions that affect them. Over the last 12 months, we have seen some notable successes, including in 2019-20, we exceeded our annual new build target of 550 units by delivering a total of 861 homes. 215 households moved into new housing, which is designed to meet the changing needs of households, including those with temporary or permanent physical disabilities. Working with our partners, we also ensured residents and tenants have access to services to enable their homes to be adapted to meet their medical needs. 159 major adaptations were carried out in private homes, and 95 major adaptations and 257 minor adaptations were undertaken to council tenants' homes. During 2019-20, a new multi-agency independent living panel met monthly to consider referrals and assessments for people with particular support needs who required suitable accommodation and supports to live independently. An accommodation guide to independent living was developed to support people to understand the types of supported accommodation available and how to begin the process of accessing independent living. Feedback has been very positive, with families feeling they are able to make more informed choices and decisions about housing and support. We have also invested in good quality housing, as this has a direct impact on the general health and well-being of households. In 2019-20, we invested £8.7 million to improve our council homes. Evidence suggests that people who were living in homes which met the national quality standard resulted in 39% fewer emergency admissions compared with those living in homes that were not upgraded. Alongside this, we have also invested and developed our sheltered housing services, responding to issues affecting older people such as dementia, social isolation and loneliness. A focus on inclusive living ensures accommodation and support can be accessed and used by as many residents as possible. As a result of our hard work over the last 12 months, many people have been able to access housing of a type and in an area that is suitable for their current and future household needs. We are enabling them to live independently at home for longer, which has had a hugely positive impact on their health and well-being. This is just some of the work we are doing. However, the ageing population of Perth and Kinross, along with increasing demands for complex adaptations to existing homes and for specialist housing, means there are challenges ahead. We have developed a plan with our partners for our services and delivery models to ensure we will remain in a good position to meet those challenges, so that everyone in Perth and Kinross can have the housing they need to live independent and healthy lives.